Okay, here we go. Teaching this innate behavior of giving compassion and sympathy and empathy. This is an innate behavior. It is impossible to teach. But what I can do is provide you information and strategies to be interpreted and utilized individually. 1 in 5 people can benefit from mental health support. This can be anything from coping mechanisms, stress, anxiety, and of course, euthanasia. Then we factor into this that we deal with this in veterinary medicine often. So, not just the euthanasia, we are also a high industry of burnout and compassion fatigue. And just how when you fly on an airplane, you're always told when the oxygen mask drops, put the mask on you first before helping others. We need to take care of ourselves as individuals in this field. So, from the AVMA website, compassion, we'll start with compassion satisfaction. So, start with a positive note here. Compassion satisfaction. Degree of fulfillment, sense of purpose and satisfaction derived from working as a care provider. Compassion stress is unavoidable. It's the experience when helping others in distress. It is derived in the responsibility and desire to alleviate suffering. So we deal with compassion stress when we are experiencing our job, helping others. Compassion fatigue stems from compassion stress. So it's the state of exhaustion, physiologic and emotional dysfunction from prolonged exposure to compassion stress. And remember that compassion stress is our normal response. We can't avoid it. Individuals experiencing compassion fatigue are overwhelmed from bearing the suffering of others. This could be patients, clients, or coworkers. But even though we are overwhelmed, we continue to engage in self-sacrifice in the interest of helping our patients or our clients. Big factors that affect the severity of our compassion fatigue are the duration of the experience, our high empathy, the potential for reoccurrence, exposure to death and dying, and the pressure of moral conflict. So, burnout is the psychological syndrome that involves prolonged response to chronic interpersonal stressors on the job. So, emotional exhaustion, personal inefficacy, criticism, and ineffectiveness in the work environment. So, those all came from the AVMA website. Then we have places that will help us with our emotional needs. There's not one more vet and there's not one more vet support staff because we have the highest incidence of suicide rate, and not one more vet was established from the suicide of Dr. Sophia Yin. She was a board-certified behavioral specialist. She was very successful, helping, caring, and no one will know or understand why she took her life. So sometimes in veterinary medicine, we get harsh comments from owners experiencing stages of grief. It's hard to realize when they are saying things like this to you. Say things like, you don't care about animals, you didn't do anything to help my pet. It's very hard. Sometimes they're irrational, so we need to understand the stages of grief. Part of our objectives are we also got to understand the human-animal bond. We're going to identify that senior and geriatric pets need care. And regarding euthanasia, what signs do we need to look for to help with our owner's grief? If you search veterinarian suicide, this video will pop up. This is a TED Talk, and if this is posted on YouTube, I do not have the rights to play it. So go ahead and look that up on your own. She does a great job of capturing what a busy day at the clinic is like, what some harsh factors of owners can say to us as veterinary professionals, and then how can we together as a team with the owners help prolong the life of our pets. Take a moment and read this introduction. Society is changing. 80% of our animal companions now live inside. Companion animals provide stability, constancy, and security. People no longer are living in a short distance of their extended families. The families are smaller, consisting of average of 2 children, or they're single-parent families. And many school-age children return to home greeted not by their mother or father, but by the family pet. So an increase in number of adults that live alone or couples that opt to remain childrenless. So more and more people are filling these voids with pets, which provide the unique outlet for their owners' needs to nurture and be loved. So as health care and medical care improves, the number of persons in the age group over 60 years is increasing. And so with that, pets fulfill many needs of elderly people, including needs for interaction, exercise, companionship, protection, and motivation to remain active and independent. As society has realized the special talents of pets, specially trained animals, they're here for protection, love, animal assisting programs for people with all types of physical and mental disabilities. Animals facilitate interactions with people who may be reluctant to interact. Their presence reduces anxiety, lowers blood pressure, decreases heart rate. Even some studies indicate that animals may alleviate or prevent depression. Survival rates for cardiac patients who are pet owners are higher than those that do not own pets. In short, the relationship between people and animals have become physically closer, and the role of animals in the daily lives of owners has become more emotional as society has changed. 83% of pet owners refer to themselves as mom or dad, 93% buy their pets gifts, 84 treat them as children, and 63 say, "I love you," at least once a day to their pets. The degree of attachment varies greatly. Of these strong attached owners, about half see their pets as reflections of themselves or their taste with the pet, depending on the owner for love, affection, and care. The other half of strong attachment owners report that their pet as an emotional crutch, supplying unconditional love and affection, and sometimes acting as a substitute for family, friends, or children. As pets are used to meet many of the changing needs of modern society, the intensity of the attachment has increased. When pet loss occurs, the intensity and duration of attachment determine the significance of the loss. So, the intensity of the grief that follows, so the more intense the attachment is, the more the grief will be. An owner of assistance dog therefore may suffer more intense bereavement than the owner of a dog used only for herding and hunting. Owners who have experienced previous significant losses adjustments, or traumas and have been comforted by their pet's presence may also exhibit strong attachment and thus more an intense bereavement. As a reminder of both pleasant and traumatic events in people's lives, pets can take a symbolic meaning. So the levels of attachment that differ for each pet and owner in the human-animal relationship may be perceived as stronger and more important when each of the following things are present. Out of these 7, first, owners believe that they rescued their companion animal from death or near death. Second, owners believe that their companion animal has got them through a difficult period in life. Third, owners spent their childhood with their companion animal. Fourth, owners have relied on their companion animal as their most significant source of support. Fourth, owners anthropomorphize their companion animal. Oh, that was fifth. 6, owners have invested extensive time, effort, and financial resources in their companion animal's long-term medical care. And then finally, 7th, owners view that their companion animal as a symbolic link to a significant person who no longer is part of their life, but that's significant in a certain time of their life. Loss of a pet can be difficult. Making the job more difficult is the fact that grief and bereavement are emotional and often irrational areas of human interactions. Most of society rarely has formal training in this area. Bereavement individuals at times may seem out of control or out of touch with reality. When this happens, those around the griever, including the veterinary professional, may feel uncomfortable. Few veterinary professionals are taught how to support or deal with people who are irrational or emotional. Compassion is an important sensitivity to draw on when interacting with clients experiencing grief. Grief is the companion to death. It is the mental anguish experienced by a human who is confronted with the loss of an object of attachment. Grief may include loss of death, divorce, loss of a job, or even moving or having friends move away. It can be intensely emotional and can affect mind, body, and spirit. When confronted with grief, the bereavement individual goes through a grief process. The term grief process implies that there is an intended end or a result to be produced through grieving. Thus, the grief process is the means of letting go of the object of attachment so they feel better, emotionally grow, and can attach again. The euthanasia. The pet's well-being, so caring for aging dogs and cats, consists of a proactive, comprehensive healthcare program. So older dogs and cats should incorporate owner education. We should do disease prevention strategies and detection of medical and behavioral problems at the earliest possible stage. When the prognosis may be more favorable and treated options are likely to be more numerous. The term senior and geriatric describes the life stage of progressive decline in the physical condition, organ function, sensory function, mental function, and immunity. Starting at 7 years, many veterinarians recommend routine physical examination of healthy animals twice a year. This is advocate routine diagnostic screening for developing disease. Patients with chronic illnesses may need more frequent examinations. The veterinary staff is in a unique position to assess clients as they go through the process of grief, as it relates to the loss of a pet. By way of our unique role in the life of the pet and the owner, and as our unique ability to understand the bond that has developed, and in addition, that we may interact uniquely in choosing the time of the pet's death, as when euthanasia is performed. It is a difficult choice and it is a difficult bereavement process. These videos depict how humans are now choosing euthanasia in some places, and the controversy and moral thoughts about no-kill shelters versus kill shelters. The death of a pet is all too often regarded as a trivial loss by society, perhaps in part because of the mistaken belief that pets can easily be replaced. Further, people are rarely granted time off from their jobs to take care for sick animals or make arrangements for them after their death. Society does not allow adequate time for mourning a death. Most people feel pressure to be back to normal within a few days of their pet's death and avoid being labeled as neurotic, hysterical, or overly attached. However, crying, taking time away from work, and wanting to memorialize a pet are healthy responses to the death of a pet. People should not be discouraged, nor should they be judged. One of the most effective ways for the veterinary professional to assist in the grieving of clients is to educate and reassure them that their feelings and behaviors are normal parts of the grief process. Shock often happens at the beginning, but there is denial. What a client needs most is time, support, understanding, and permission to grieve. So, denial before death. Communicate clearly. Avoid using medical jargon. Give the client time to think about and grasp the reality of the information that is given. Some clients need only a slight pause in the conversation or a few minutes alone. Other clients may need more time to themselves before they comprehend the news of a severe illness or actual death. Refrain from judging a client as stupid or out of it. Never attempt to force a client to come to their senses or move out of the denial phase. So after death, encourage the client to view the body and say their goodbyes and give them permission to grieve. Quite often this is saying, take as much time as you need to say your goodbyes. We have a button system in place where we leave a button so that we're not coming in after 2 minutes, 5 minutes, 10 minutes, whatever it may be, so that they can take as much time as they need. The anger stage. This is when you just need to listen to the client, give the client permission to vent their feelings, and if the client is getting directly angry at the veterinarian, the staff may take a step backwards and pause with a deep breath. Do not become defensive. This is relieving guilt by assuring the client that he or she did the right thing and that whatever they are feeling is part of the normal grief process. If you're listening actively while using attentive body language, you can clarify and indicate your understanding of the client's feeling. For example, I can see that you're angry, or you feel that a diagnosis could have been made sooner. Don't take it personal. Understand that bargaining is an attempt to control or reverse a dire situation. The client feels irrationally compelled to bargain during this grief process and does not mean to doubt the professionals involved. When a patient is terminally ill, Do not become defensive or threaten when a client asks for other opinions to consider treatments. After death, be empathetic and educate about the stage of bargaining when a client confides their feelings about bargaining behaviors, such as prayers and dreams of the pet still being alive. Reassure them that the emotional bias for the behaviors and feelings is normal, even though it may seem irrational. When clients inquire as to when to replace their pet, educate them about the role bargaining plays. State that their dead pet was unique and cannot be replaced, but encourage them to obtain a new pet whenever all members of the family feel ready. Encourage them to also choose a different breed, color, and gender, and a new name. Encourage depressed clients to talk about their feelings in regard to their pet, then maybe follow up with a telephone call in a few days, and then again in 2 weeks. Validate their feelings of sadness by letting them know that this is normal. Offer to call a family member or friend, and encourage and suggest means by which the client can memorialize their pet, like making a scrapbook, planting a tree, writing a letter to their pet, writing their pet's life story, and if the client still continues to express depression after several weeks, refer them to a support system. Many communities have established support groups and private counselors, increasing the loss of the pet. Sorrow is sadness, and it is a huge part of the healing process. All emotions should be validated. Acceptance is achieved once all the previous 4 stages have fallen into the background of the client's life. At this point, the bereaved person can channel emotional energy into a new relationship. The veterinary professional can help clients reach the resolution state by offering insight to the grieving process through his or her actions or by offering suggestions of reading material or seminars on the grief process. So we should be prepared for this, and we can even help with referring them to hotlines, and quite often we give a sympathy card where everybody in the clinic signs it. We can make paw prints, either clay or ink. We could add clippings of fur to help them. That is what their memories are of the pet. And in summary, the loss of a pet and the grieving associated with it constitute a difficult process, both for the pet owner and for the veterinary personnel. Despite this difficulty, veterinary professionals deal with the illness, loss, and euthanasia of their patients on a daily basis. Yet they are rarely trained in how best to address the grief with their clients. Nevertheless, it is important for us veterinary professionals to provide a positive, supportive environment for pet euthanasia and help clients with their subsequent loss. If euthanasia is performed poorly, it can be a disastrous experience, both for the client and the veterinary practice. If performed with practice, care, and gentle concern, it can be remembered positively for a long time. The ability to emphasize, maintain balance and perspective, and be compassionate is essential. The veterinary team can be available, can listen, can validate clients' feelings, emotions, struggles, and offer referral when they need more help. The veterinary staff and results with positive growth and adding fulfillment for both the client and their lost pet.